Hi, thank you. Chairman Friedman, Chairman Lon, and the members of the Joint Committee on Healthcare Financing, I'm here to give testimony in support of House Bill 1267 and Senate Bill 766, an act establishing Medicare for all in Massachusetts. I'm a practicing RN. I've been practicing for over 44 years. I'm a member of the Massachusetts Nurses Association and represent the M&A on the board of MassCare, which is a citizen coalition advocacy organization working to build support for single payer. There are 2 points I'd like to address. Of course, I'd like to talk to you all day, but I don't have that time. The first is that even though we look at in Massachusetts, we have only 4% of our citizens are uninsured. In reality, what I see in the emergency room every day are the people whose insurance has lapsed, or the woman who's a single mom who's left the spouse, or the spouse has left her and left her without insurance, and so on. And I'll give you an illustration of that. 2 very quickly. One, a middle-aged mom fell and broke her hip and her leg last winter on the very day that her coverage expired. She had just been laid off from a very good city job. And she, passerby called 911. The patient declined to get in the ambulance because of her fears of paying her rent. And instead, the responders lifted her into her car and she drove 9 miles to a hospital, which actually caused severe worsening injury to her leg. She eventually did get insurance, but she was left with injuries because of that reason. People make decisions like that. They're desperate. And also this past weekend, 55-year-old male came in. He had a great job for years, got laid off during COVID, now works a minimum wage job, broke, came into the emergency room very short of breath. We thought he had COVID. He did not. Turns out likely cancer. His insurance just expired, but he can re-enroll on November 1st, next week, but he won't have coverage until January. So he's going to go several months with no care for what has been discovered as a life-threatening illness. And we see this often. The other problem that I see as a case manager in the hospital are the prior authorization, which was, I'm sure you've heard about it, and there's lots of data from CHIA and the American Medical Association about physicians in particular and providers and hospitals that spend enormous amounts of money and time on getting prior auths from insurance companies. It's a market initiative designed to control cost. It cannot and will not ever work. The legislature, no matter what we do, we cannot control how insurance companies work with all of these different initiatives. And I know we're looking at caps in the future. It's just not going to work. Right now, it's these methods, including the prior auth in particular, is overused, inefficient, causes higher cost because so many people are involved, causes avoidable extra hospital days. At worst, interferes with clinical care. And I think 87% of doctors have said it leads to adverse outcomes and death. Most doctors have admitted to not understanding some of the prior authorizations and don't have the staff to obtain them. And 32% say that prior auth decisions are not evidence-based. I do this work. I interface with the insurance companies for a hospital. The insurance company closes at 4:30 in the afternoon. They're closed on weekends and holidays. Some patients can't get an auth and stay in the hospital for 3 days or more, which is an enormous cost to, if you're on Mass Health or if you're on any Blue Cross, it doesn't matter. It's a cost to Massachusetts. And then the worst case is an authorization that is entirely in the interest of the payer. And this is my worst story. A 33-year-old male came in, clot in the artery in his neck, and this is at Cooley Dickinson. We do not have neurosurgery there. Tried to get him into a special neurosurgery hospital. His payer, based in Massachusetts, refused because it was out of network. Yet they were unable to have a neurosurgery bed or a vascular surgeon address his illness. He languished at Cooley Dickinson, having this clot chip away at his brain for 3 days until we could transfer him to the in-network hospital. And I might say, I could give you lots of examples, but I see this happen every single day. every week. And when I went through the hospital this week and spoke to the physicians, I spoke to 7 physicians and told them I was testifying this week. Every one of them said, please talk about prior authorization and how this will never work. Get rid of the insurance companies. I did not have a single physician, and this is anecdotal, of course, but that was the most painful piece of market-based health care that they have to deal with. So I urge you to consider as soon as possible to take this heavy lift and consider moving toward getting a single payer system in Massachusetts.